now, what are the different types of non-surgical anti-aging treatments?
Yeah, so before I move on to the non-surgical anti-aging treatments, I would want to very quickly tell you about some skincare routines that you can, the right skincare routine that you can follow before you start thinking about a procedure that you can get at a dermatology clinic. So maybe the right diet can help. And a lot of times diet that is lacking in the right vitamins and minerals and antioxidants, that's going to cause a lot of aging. So diet that is rich in vitamins, minerals, antioxidants. So maybe incorporating a lot of vitamins, the fruits and vegetables of different colors, which have all the right antioxidants, that's going to help. And also following the right skincare routine will also help. So when I say the right skincare routine, you have to ensure that you apply a sunscreen, and the right sunscreen with the right SPF and PA rating, at least 40 SPF and at least 3 plus PA rating. And you have to apply a sunscreen all your life, 365 days of the year. And even if you're indoors, even if you're not going out in the sun, you should apply the sunscreen. That's the step one for if you are thinking of an anti-aging skincare routine. Then the next step would be the right molecules. So that depends on your age. If you're 20, 25, I would suggest the right molecule would be maybe just a vitamin C serum. So incorporating the right vitamin C serums in your skincare routine is going to help. Vitamin C, they work by boosting collagen, and they improve the texture of your skin, and they're going to work on the blemishes. So they impart brightness to your skin. So that's the second step. Now, if someone with the 5 plus, I would suggest you apply retinols. You incorporate a retinol serum in your skincare routine. So retinols are, these are also anti-aging molecules, and they work by improving the dead cell turnover. So the second thing would be a retinol serum, which you can apply if you're 25 plus. And retinol serums, since they improve the dead cell turnover, they are going to slowly work on your fine lines and wrinkles. They work they work on the premature aging, and they're going to improve the quality of your skin, improve the texture and tone of your skin. They are going to work on your open pores also. So retinol serum is the next important thing that you can do. And then comes the peptide. So peptide is my personal favorite because peptide works as a barrier repair also. And besides reducing the collagen breakdown and improving the collagen production, it's going to make your skin very hydrated and plumpy. And the good thing about peptide serums is that you can apply it even if you're doing a retinol in the night. You should apply a peptide serum in the morning. And also, peptide serums are something that can be done by anybody. So even if you have a very sensitive skin and you cannot apply retinol, you can apply a peptide serum. So a sunscreen in the morning and a retinol in the night. A peptide in the night if you're not doing a retinol serum, and a peptide in the morning before a sunscreen if you're applying a retinol in the night, and a vitamin C serum if you're less than 25. So not everybody would need something as aggressive as a retinol. So you can do well with just a vitamin C serum in the night and a sunscreen in the morning. Now that I've told you everything about the right skincare routine for anti-aging, now we can discuss the anti-aging procedures that are available at dermatology clinics. So before I move on to the anti-aging procedures, so there are a lot of things that you should know about the procedures. So there are different types of procedures, and the procedure that your dermatologist is going to decide for your skin concern will depend on your age, on the skin concern that you have, and not one procedure. There's no single procedure that's going to fit on every skin. So it is going to be always customized according to your skin type, your skin concern, your age. And it can also be, tailor-made according to your budget also. So the most popular anti-aging treatment that all of us must have heard about is the botulinum toxin. Botulinum toxin are injections that are given on the muscles that are that cause that wrinkle. So if you're smiling, then you're using some muscle, and if you're frowning, then you're using some other muscle. So botulinum toxins, how they work is that they relax the muscles, and which is how you will see that after these injections, when you are using that muscle also, you will not get that line. So that's how botulinum toxins work. And the second thing would be a filler. Now, filler are totally different from botulinum toxin injections. Fillers are they are hyaluronic acid. So hyaluronic acids they act as filling agents, and they are important for sagging skin. So if somebody has laugh lines, or the skin is sagging, or you're getting marionette lines, which are lines that you have around the mouth, so something that gives you a sad smile, drooping angles of mouth, or lines, the hollowness or jowls that you get here on the jawline. So for those, or fillers are for the under eye hollowness. For correcting the under eye hollowness or the under eye puffiness. So fillers are different from botulinum toxin, and they are going to work by replacing that collagen that is lost with age. That's the second thing. And the third anti-aging procedure would be threads. So threads are also, they are placed below the skin, and they are for lifting. So if the skin is sagging, that's something that happens with time. Then with fillers, the skin gets lifted, and we can replace the collagen. It gets back to the place where it should be, and the skin looks lifted, and it looks tighter, and it looks more rejuvenated. Now, these are the three main things. Now, other than these procedures, there are a lot of lasers and energy-based devices that we can do to improve the texture, tone, and quality of skin. So there are fractional lasers. Fractional lasers work by reducing the superficial wrinkles and fine lines and texture of your skin. These are lasers. So it is basically a light-based device. So when the light falls on your skin, it triggers collagen production on your skin, and you will see that the fine lines and wrinkles slowly go down, and there'll be a little bit of downtime. But with every session, you will see that the skin quality and texture improves. The skin becomes tighter, and you will see that you start getting back the glow also. The skin looks more rejuvenated, and the dullness also goes down. So that's about the lasers. Now there's micro needling radio frequency that's slightly different from lasers, and there is high intensity focused ultrasound. That's also another device, or micro focused ultrasound, that works on a slightly different technology. And so these are devices that these are procedures that you can get maybe once a year to reduce the sagging of your skin, to reduce the fine lines and wrinkles of your skin. Another important procedure, a very popular procedure, is the vampire facial. So vampire facial is different. It's a treatment where we take your blood, and like for a routine blood test, and then we infuse it in your skin. So after a derma pen, or after a laser, or after a microneedling radio frequency, we can infuse your platelets. Your blood has platelets, which have very good growth factors, and we can infuse it on your skin. And when we infuse it in your skin, slowly with time, you will see that the skin becomes better. The quality of your skin improves. So that's about the most popular procedures in dermatology clinics.